Thank you very much for gathering here today for this informative talk on AIDS is not over. I appreciate that many of you had taken time out of your busy working schedules. For some of the mothers and some of the wives in the room, you could be taking care of your children, or you could be cooking for your husbands, but you have taken time to be with us. For the youth in the room, I know that there are so many fun projects and youth programs that could be running at this time, but you again have taken time to join us today, and I am very grateful for your presence. I want to acknowledge the community leaders, the teachers, as well as the ministry leaders that are in the room for this informative talk. And I'm just going to jump straight into it and start to set the scene by actually laying out what are the objectives of this talk today. So it is simply to accelerate the HIV response by bringing awareness to communities such as yours on the available HIV prevention options. Why are we still talking about HIV 50 years later after the start of the epidemic? Well, that is because, as you can see here, this is a map showing the globe, and sub-Saharan Africa has got a high number of cases. Prevalence, cases and deaths from HIV and AIDS since the start of the epidemic have shot into the millions. We're looking at 84.2 million people who have become infected with HIV. 40.1 million people have died from AIDS-related illnesses, and 38.4 million people globally were living with HIV in 2021 when these statistics were taken, and 1.5 million people became newly infected with HIV that year. These are very, very shocking numbers and very huge, and that is why we have to curb the infections. Now, this is where we have to start having the conversation on how can we prevent HIV. And I'm looking to the youth in the room, but I'm also looking at everyone else in the room, because this sounds so old school when we say it. Practice monogamy or limit the number of sexual partners that you have, because that is actually a way that you can prevent HIV. What is it that I've heard? That the sweet is not as sweet when it has its wraparound. But when it comes to HIV, the use of condoms is so important, because it actually protects you from either getting infected or from passing on the infection to someone else. And so that is another way that we can prevent HIV. It goes without saying that you have to make sure that you are getting regularly tested for sexually transmitted diseases as well as for HIV, so that you know yourself and you know your status, and that way you are able to protect the next person. And for the mothers or for the women that are in the room who may already know that they are HIV positive and pregnant, then you can actually protect your own health, and you can lower the risk of passing on HIV to your unborn child. And you can do this by making sure that you take drugs for HIV and you are prescribed medication by your healthcare provider, your doctor, or the pharmacist. Another way of preventing HIV is to make sure that you are not using injection for drugs. And these are just some of the ways that you can prevent HIV. But let's also talk about the use of pre-exposure prophylaxis. And this is something that you can talk to your healthcare provider on, and the use of post-exposure prophylaxis. Well, you might ask, what are those? Well, they are HIV prevention methods. They're both medicines that help reduce your chances of getting HIV from sex or injection drug use. You might ask me, how do they work? Well, there's many options. You can take them as pills, you can take them as injectables, or you can take them as a vaginal ring. And how often do you have to take it? Well, it depends. It can be regularly or as needed. Now, let's go into more detail and talk about taking PrEP. We've already set the scene and we've already talked about three ways that you can take them. So you can take them as pills, you can take them as injectables, or you can take them as a vaginal ring. For the pills, there are two drugs that are currently available at your local pharmacy. And if you were to ask your healthcare provider or your doctor for a prescription, this is what you would be offered. Truvada and Descovy, these can be taken by mouth. They are taken once daily or when needed. And these are available for people who are at risk of HIV through sex or drug use. And Descovy, however, is not for people who are assigned female at birth or who are at risk for HIV through receptive vaginal sex. With the injectables, we have a drug called Apetrud, which is a single antiretroviral drug, which is given as an intramuscular injection every 2 months by people at risk through sex who weigh at least 35 kgs. Now, with a vaginal ring, we have a drug called dapivirine, which may be, well, it's not a drug, it's a vaginal ring, which may be offered as an additional prevention choice for women at substantial risk of HIV infection as part of a combination of prevention approaches. Taking PrEP. Now, we know that there are situations where we may end up in and we need something for emergency. And this is what PrEP is. It is a preventative of HIV infection if you started within 72 hours of actually being exposed to HIV. It is for emergency use only. What it is not is a substitute for regular use of other prevention methods for HIV. It can be administered as a single or as 2 tablets over a 4-week course. It obviously depends on the drug that you are offered at the pharmacy. And it does reduce the risk of contacting HIV by more than 80%. So it is very, very effective. It is safe, but it may cause you some side effects. But again, this depends on some people. And in the event that you do suffer some of these side effects, it is not fatal. And therefore, they can be treated and they're not life-threatening. Now, you might be sitting in this room and you're saying, well, I'm a sex worker, or, I am actively sexual with multiple partners, or I'm in a polygamous relationship or marriage. So how can PrEP and the use of PrEP actually benefit me? Well, it can be used to protect your health anonymously to your partner or to your clients because they don't need to know. And it can be something that you are only privy to. It can be used for any job within the sex industry, including porn, because you can use PrEP before you actually start doing your work. And then it allows for service that requires condomless sex, which means that for those that might be in a polygamous relationship or marriage, your partner does not have to know that you're actually taking PrEP, and therefore protecting yourself from HIV infections. And it then provides you with a good safety net and no side effects as well. You may be part of the LGBTQ community, or you might be injecting drugs and you're wondering, how can PrEP benefit me? Well, facts say that it's highly effective at preventing HIV infections in both gay men, heterosexuals, and bisexuals. And when it comes to drug use, it does reduce the chances of contraction by 70%. It has the most powerful single effect compared to any other HIV prevention measures in this particular group, and it has no side effects. So your question is answered in terms of, can I use PrEP? Should I use PrEP? I will end my presentation by sharing this testimonial by a transgender woman. It reads, being introduced to PrEP has been timely for me. My boyfriend and I went to IHCC for PrEP. I didn't know my boyfriend's status, and he also didn't know his status. After we were tested during the screening for PrEP, my boyfriend was HIV positive and I tested negative. We both received education on how to be safe. and he received his ARVs while I received my PrEP drugs. Now, this is a situation, and this is a testimony amongst many other success stories that we've heard from people who have used PrEP and PEP as HIV prevention methods, as well as all the other ones that I shared earlier on. And these are people who are taking a stance for their HIV status. And I really hope that this talk empowers you to do the same. And not only are you protecting yourself, but you're also protecting the communities and the people around you, and you are curbing the infections of HIV so that we can put a stop to this epidemic. Thank you very much for taking time to listen today. Thank you.